Assalamu alaikum. Now I would like to discuss about three topics in a row. One is schizoaffective disorder, another one is catatonia, and the last one is brief psychotic disorder. Okay, start with my intro where you will hear a murmur. Can you tell me the name of the murmur? Okay, can you tell me the name of the murmur? Okay, put it into the comment box and I will tell about this murmur at last part of my video. Okay, start with this stem. Okay, a 32-year-old man. Why? He comes to the emergency department by his mother. She says that she says that he has stayed up late every night for the past week and praying, shouting, "He is the Messiah! He is the Messiah!" The patient speaks rapidly without interruption. So this feature, speaking rapidly without interruption, looks like manic. Okay, in this, whenever you find this type of question, try to make more and more differential. If you can create lots of differential, then you can differentiate from those differential. Okay, believes that he has some special powers. Okay, he shakes his head in response to his voices, this and that. The patient has a history of psychiatric illness since his early 20s, so he has a history of psychiatric illness. He was discharged from military. He was discharged from military due to severe depression and suicidal ideation. So he works in the military and he was discharged due to this depression and suicidal ideation. After that, after that, he heard voices blaming him for all the suffering in the war. So the voices blame him. Now this is the feature of the psychosis. He he has been hospitalized for several depressive episodes over 10 years. Between hospitalization, he has episodes lasting for several months during which mood is stable. So between hospitalization, he has periods for several months during which the mood is stable. He has continued to hear the voices of God and the devil. The patient lives with his mother and is able to work stocking groceries, but he spends most of this time alone. He has been prescribed risperidone, and his mother is unsure that if he takes it regularly, which of the following is the most likely diagnosis. Okay, one, I have said manic, so bipolar disorder is one of my differential, and he has like kind of schizo plus effect, like, so schizo plus affective like mood problems. So combination of schizophrenia along with mood problem. Why I'm saying schizophrenia? He is hearing voice. Auditory hallucination is a part of schizophrenia. And there is a significant point in here. Within hospitalization, he has periods lasting for several months during which his mood is stable. Okay, now, so this is schizoaffective disorder, major depressive or manic episode concurrent with the symptoms of, so major depressive or manic episode concurrent with the schizophrenia. Lifetime history of delusion or hallucination for more than 2 weeks in the absence of major depressive disorder. So lifetime history of delusion or hallucination more than 2 weeks in the absence of MDD or manic episode. Mood episodes are prominent and recur throughout the illness. So he has mood episodes are prominent and recur throughout the illness, not due to substances and other medical conditions. So these patients' clinical presentation history are consistent with diagnosis of schizoaffective disorder, bipolar disorder. He currently exhibits symptoms of manic episodes. He also meets DSM-5 criteria. A for schizophrenia. Uh, two more than two of the following like delusion, hallucination, disorganized speech, and grossly disorganized behavior. There is persistent hallucination more than 2 weeks in the absence of major depressive or manic episodes. So his history indicates a period of hallucination more than 2 weeks in the absence of major depressive or manic episodes. So schizoaffective can be differentiated from schizophrenia, very high L, and bipolar disorder by assessing the relationship of mood and psychotic symptom over the course of illness. Mood, psychotic over the course of illness. Mood, psychotic over the course of illness. Mood and psychotic over the course of illness. If mood symptoms occur in schizophrenia, they are typically present for a small portion of the illness. In contrast, if these patients' mood episodes appear to be present for a significant portion of illness, making schizophrenia less likely. So, if mood symptoms occur with schizophrenia, they are typically, and for a small portion, if mood symptoms occur in schizophrenia, they are typically present for a small portion of the illness. But in contrast, the mood episode appear to be the present for a significant portion of his illness, then it is schizophrenia less likely. In bipolar disorder, psychotic symptoms occur exclusively during the manic or depressive episode. So, in bipolar 1, psychotic symptoms occur exclusively during manic or depressive. The persistence of hallucination when this patient's mood is stable rules out of bipolar. So the persistence of hallucination when this patient mood is stable rules out the bipolar. So these are the clue point for from uh, differentiating schizoaffective from bipolar disorder from schizophrenia. Okay, okay, look at these stem now. Uh, BPD, brief psychotic disorder. A 22-year-old man is brought to the emergency department by his roommate for evaluation of his weird behavior. 8 days ago, the patient, okay, this patient, the patient died in a car accident. 8 days ago, the patient's father died in a car accident, not the patient. So patient's father died in a car accident. Since then, since then the patient has been sleeping poorly and eating minimally. His roommate says that he has been keeping all the lights off in the apartment. Yesterday, I walked in, sitting alone in the dark and whispering as if someone else was there. When I switched on the light, he immediately closed his eyes and covered his ears. The roommates reports that the patient is studying computer science and has been on the honor roll every semester. As an adolescent, the patient was treated for a depressive episode shortly after his patient divorce. He has no significant medical history and does not take any medications. Okay, on mental status examination, he appears unkept and hypervigilant. His response are short, unrelated to the question. His response are short, unrelated to the questions being asked. Which of the following is most likely diagnosed. It is not acute stress disorder. It is brief psychotic. Why it is brief psychotic, not acute stress? In brief psychotic, there is disorganized, bizarre behavior, like keeping lights off, closing, covering ears, disorganized speech, nonsensical response, and probable hallucination, whispering to himself on the dark. Is consistent with brief psychotic disorder, and he has a history, and it lasts more than between 1 day to 1 month. It lasts between 1 day to 1 month, and it is triggered by traumatic or stressful event, can be specified with marked stressor. It is There is a traumatic or stressful event can be specified with marked stressor. But in acute stress disorder, the most important thing in here, in acute stress from acute stress disorder from the brief psychotic disorder. In brief psychotic disorder, the patient is not in the scene. But in acute stress disorder characterized by intrusive re-experiencing of the traumatic event, accompanied by symptoms of hyperarousal, dissociation, avoidance, lasts for 1 month. In acute stress disorder, patient was in the scene. Like if the car accident happened, if uh, if in the car the patient if in the car the patient is present but he survived, and he has seen his father to be in the deathbed, then it would be acute stress disorder. So in acute stress disorder, patient should be in the scenario. So brief psychotic disorder characterized by acute onset psychotic symptom, disorganized speech behavior lasting 1 day. It can be triggered by marked stressor, such as loss of the loved one. Okay, finally the catatonia. If you look any stem, when physician lifts his arm, it remains the exact same position. It looks like catatonia. For C, the treatment is B, like benzos. And my old theory, like if you find a case with acute condition, then benzo is the drug of choice. So if benzo does not work, ECT. So immobility or excessive purposeless activity, mutism, stupor, negativism, posturing, waxy flexibility, echolalia, echopraxia, mimicking speech and movement. So this is all about the catatonia. Okay, now the usable inner circle part of my lecture. If you want to differentiate these three, schizoaffective, first of all, major depressive or bipolar disorder with psychotic feature. Psychotic symptoms occur exclusively during the mood episode. That is, psychotic symptoms occur exclusively during the mood episode. If psychotic symptoms occur exclusively during the mood episode, it is major depressive or bipolar disorder with psychotic feature. Schizophrenia mood symptom, if present, are brief and not prominent. In schizophrenia mood symptom, if present, is not that amount, but the schizoaffective major depressive or manic occurs concurrent with the symptoms of the schizophrenia. Lifetime history of delusion, hallucination for more than 2 weeks outside. Lifetime history of delusion or hallucination more than 2 weeks outside the mood episode is present. This is IL. Like lifetime lifetime history of delusion or hallucination more than 2 weeks outside this mood problem, and mood episodes are prominent and recur throughout the illness. That is schizoaffective disorder. That is all about lecture. And the murmur is AR. That's all.